Here at the World Health Organization headquarter in Geneva, during their latest press briefing, the director said that even this most severe situation can be turned around, and that cities and countries had pushed back this virus gives hope and courage to the rest of the world.
Every day, we are learning more about this virus and the disease it causes. One of the things we're learning is that although older people are the hardest hit, younger people are not spared.
Monsignor Robert Vitillo is a trained social worker and expert on refugee services, HIV/AIDS and global health. He thinks that the Catholic Church has given strong and factual messages.
Both in terms of the messages from the Holy Father, which are constant every single day, his message about the need for prayer, but also about the need to take precautions so that we don't put ourselves at undue risk, and even his recognition of the fact that it was important to limit the large crowds of people who would come to hear him speak or to be in St. Peter's Square at the Sundays during the Angelus blessings. And so for that reason, the Vatican has limited those crowds and now is having the Pope both speak for the audience, the general audience, and then also to pray with people the Angelus prayer and give his blessing through live streaming. I think those are important measures that the Vatican has taken, and now also that many bishops' conferences and bishops themselves have taken to limit the availability of public masses as well.
Recently, the World Health Organization started their COVID-19 Solidarity Response Fund to raise $675 million for research and development of test kits.
We know that for many people, life is changing dramatically. My family is no different. My daughter is now taking her classes online from home because her school is closed. During this difficult time, it's important to continue looking after your physical and mental health. This will not only help you in the long term, it will also help you fight COVID if you get it. First, eat a healthy and nutritious diet, which helps your immune system to function properly. Second, limit your alcohol consumption and avoid sugary drinks. Third, don't smoke. Smoking can increase your risk of developing severe disease if you become infected with COVID-19. Fourth, exercise. WHO recommends 30 minutes of physical activity a day for adults and 1 hour a day for children.
The World Health Organization has shipped over 1.5 million test kits to 120 countries. The question people still ask, can we win this battle?
I do think so. It's an epidemic. It's a new one in the sense that, unlike Ebola, it's much easier to spread. But on the other hand, then it's not as deadly as Ebola is. And so we've seen other epidemics. I think the public health authorities, under the guidance of WHO, have taken good measures and strong recommendations from WHO on how to contain this. First of all, to do as much testing as possible so that we could find out who's infected and that they then could be held in quarantine, either in their own homes if they're not terribly sick, or in special facilities. That's one important way to contain an epidemic like this. And then, of course, I think the WHO has been very strong on asking people to fight against the stigma and discrimination that often happens when we have all of this fear and panic around some new challenge in the world. And WHO has been developing messages actually with faith-based organizations. I've been participating in that because they want to enlist the support of religious leaders and faith-based organizations, since they know that we have a lot of credibility and we have a huge outreach to people to give them strong factual messages.
COVID-19 is taking so much from us, but it's also giving us something special. the opportunity to come together as one humanity, to work together, to learn together, to grow together. I thank you.